my hands, gather my equipment, come into the patient's room, introduce myself to the patient, identify the patient, explain the procedure, and provide privacy. So I'm going to come in, raise the patient up to my working height, put the patient 35 to 45 degrees up, side roll down. I'm going to auscultate lung sounds. And then I'm going to check the suction, turn it on and see if it's working. And I'm going to oxygenate the patient 100%, and then I'm going to, for a little bit, and I'm going to turn it off. And I'm going to prepare my field. I have the suction kit, a towel. I'm going to put it with the patient. And open my kit. I'm going to make sure not to touch the inside of this cup. And I'm going to pour normal saline. I'm going to cover the label, make sure it's not expired, check the date. If it's within 24 hours and it's used, I'll lip it and then pour it in. If it's expired, then I'll get a new one. So I'll pour, covering the label, pour a little bit in there. And then I'm going to put on my sterile gloves. Okay, I'm going to be within the 1-inch border, and I'm going to put on my sterile gloves. Now they're both sterile. Now I'm going to keep one hand sterile, and the other hand's going to be non-sterile. So I'm going to open up my tubing. Keep it above my waist, and I'm gonna connect the suction tube to this tubing, but I will not touch my both hands. Connect that. Now the suction is on. I'm gonna turn the suction on, and I'm gonna check if the suction works. So I'm going to lip into the normal saline, and that's also going to lubricate the tubing. And I'm going to start the suction. I'm going to take the oxygen ventilation off, and I'm going to go in really quickly, and once I feel resistance, I'm going to pull back a little bit, and I'm going to start the intermittent suctioning while I come out. And that's going to be within 10 to 15 seconds. I'll put the oxygen back on, and I'll lubricate once again. And then I'll do it one more time. Go in until I feel resistance, and then come back up. Intermittent suctioning. Then I'm going to put the oxygen back on. Now I'm going to dispose of this tubing. Dispose of my glove and the tubing. I'm going to go in the garbage. And I'm going to listen to lung sounds again. And if they're clear, then it's good. If it's not, then I would do the suctioning again. Try it again. And I would dispose of all my equipment. And I would wash my hands. And that's it for the trach suction portion of the video. Okay, now I'm going to be cleaning the trachea site, the trach site. So I'm going to put on my clean gloves. Open that up. I'm going to take the old inner cannula out. And I'm going to put the new one in. I'm going to only hold up to the wing of the new inner cannula. And the remaining part of the inner cannula is sterile, so I'm not going to touch that part. And I'm going to insert it into the patient. Okay, now the new inner cannula is in. Now I'm going to clean the site. So before doing that, I'm going to pour, once again, have my normal saline, check if it's expired, any discoloration or anything. If it's good, I'm going to pour half of normal saline into the cup, and I'm going to put half of hydrogen peroxide. I'm going to check the expiration date and everything for that one. I'm going to pour a little bit of hydrogen peroxide. I'm going to take the old gauze out, put it in the garbage, and I'm going to take a Q-tip, dip into the solution, and I'm going to clean from 3 to 9 on the, around the trach, the stoma, and then I'm going to throw that out, and I'm going to use another tube. Q-tip, and I'm going to put in the solution, clean from 3 to 9 across the top. And while cleaning, I'm going to assess the site for any redness, drainage, edema, and odor. And it's good, and I'm going to dry the area with 2x2 gauze, 3 to 9, and then same thing for the top, 3 to 9. Going to place a new gauze around the area. I want to make sure the string around the neck is tight enough but not too tight. Okay, now the new gauze is onto the patient. I'm going to remove the towel. I'm going to put the side rail up, put the patient in lowest position, make sure he's comfortable if he needs anything, and I'm going to discard of all this material right here. I'm going to take off my gloves, make sure the patient has call bell within reach, and I'm going to wash my hands, and I'm going to document any abnormalities and what I've done.